My Doctor Said What is a program for health information. Be careful that if you want treatment and diagnosis of disease, you need to go to your local healthcare provider. Hi, this is Dr. Frank. My Doctor Said What? Episode 20. Can you believe it? Thank you to my over 50,000 listeners that have joined and listened to me on all major platforms. And I'd ask you to look at my YouTube videos, TikTok, Instagram, Facebook, all those things. And we'll make you a healthier, better, happier person in 23 and 24. Today I want to talk about a couple things. First one is common side effects of common drugs. So we'll talk about NSAIDs, non-steroidal anti-inflammatory drugs, like ibuprofen. They're there to help with pain. They're used widely, and they're good for that. They're great for that. They can cause you to have different side effects, causing the lining of your stomach to have issues and leading to gastric ulcers that could even bleed. And sometimes they can even lead to some cardiovascular issues. So you need to see your healthcare provider, as I always say. If you have any problems when you're taking them, and you don't want to take them long term, give yourself a break in between taking them when you feel a little better, and talk to your healthcare provider about how much and how often to take them. Some people pop them like candy, and over a long term, that's not a good idea. Aspirin, the old school way to go, can leave bruises on your body. It thins your blood. That's why people with cardiovascular issues are sometimes prescribed aspirin or baby aspirin. But you also have to realize as it thins your blood, you can bruise much more easily. So you have to be careful about that. Naproxen, which is a leading migraine medication, can leave you with neuropathy type symptoms such as tingling. You've got to be careful of that. You get upset stomach, that tingling sensation, and you can get even dizzy and nauseous. So be careful. Anytime you have side effects, you need to call your healthcare provider right away. Notify them of that and see if they can adjust the dosage. Every medication has side effects. Most are very minor, and you always want to look at the risk-benefit ratio of what they're doing for you and what the side effect is, and see what those trade-offs are, and talk to your healthcare provider about that. Modern medication is a wonderful thing, but you have to be careful how you use it. I'm talking as a toxicologist here because I'm telling you, you can have some real problems. Some people just randomly take and decide whatever dose they want. Take them according to directions that are on the bottle or on the tube or whatever, and carefully follow those and your provider's instructions. Okay, so now if we look at Metformin, a lot of people take Metformin for diabetes, control your blood sugar, and it helps control blood sugar in a number of ways. But you have to be careful. It can have some side effects, and especially if you get the dose wrong. So ask your healthcare provider, make sure you're monitoring your blood sugar. And if you have any unusual side effects at all, especially those associated with low or high blood sugar, you should talk to your healthcare provider. Prednisone. A lot of people want to take steroids, and the reason you don't have prednisone over long term, it's funny, it makes you shorter. And it can lead to things like asthma and gout. But worst of all is it can lead to problems with your liver. And so you want to really carefully have your liver enzymes monitored. Your healthcare provider will instruct you on how you need to do that and how often. But you want to make sure that you, whether it's you or your pet, that you're making sure that if you're on steroids, that you're carefully monitored. Great for pain, but you can't live on things. You have to get to the root problem eventually. So unless you have some rare or age-related diseases, and then your healthcare provider can tell you about the options with the least side effects. Antihistamines, especially if you have BPH or you have benign prostate hypertension or some other urogenital problems, can cause real difficulties with urinating, especially at night. So men, you got to be careful of that. They cause dry mouth You can even cause tissue injury because you're blocking histamine. So you want to be careful about those. And again, you want to take them as directed, and if any unusual issues, and you'll see those pretty quickly a lot of times if you take too much or take them too long, you want to talk to your healthcare provider. Afloxacin, that's a common drug for bacterial infections and can have some negative neurological effects, kind of like Cipro. Itching, lower lip swelling, ulceration. You have to be careful. That's used to treat kidney or lung infections. It's a potent medicine, but you have to watch about fluid retention, itching, swelling, ulcers. Usually the stronger the effect, the stronger potential for side effects. So you have to be careful about that. That's why dose per body weight and duration is really important to minimize side effects and maximize the therapeutic effect. Dextromorphan, a cough syrup. You got to, we've been using that a long time, and for some people, and I'm one of those people, not very tolerant of it because it causes hallucinations, and that can, especially when you're sleeping, you get dizzy or drowsy. If you fall asleep, you can have some terrible hallucinations. It's like a bad trip. So usually that's not worth it to reduce your cough. You need to replace that with a different type of cough medication. Sleeping medications, got to be really careful with some of them, and you can't depend on them all the time. And they can cause sleepwalking, which can cause all sorts of injuries such as falls. You also can get addicted really, really quickly. I didn't know what drug addiction felt like, and I broke my leg in 8 places about 25 years ago. I had to take some sleep medication because morphine for the pain in the hospital had really disrupted my sleep cycle. So I took a wonderful sleep medication that worked incredibly well, better than I thought. I mean, I fell asleep while I was trying to brush my teeth when I took it the first time. But I tell you, within 7 days, I was so addicted that I had to ask for more medication. My doctor wisely said, no, you got to be careful about addiction. I was licking literally the tablet bottle for the residue because I was getting so addicted so quickly. So you really have to be careful, be cognizant when you're looking at things like that they're not becoming an issue, because then the benefit is outweighed by the risks. So you really got to be careful about that. Lastly, I want to talk about something near and dear to my heart, and that's how we deal with high anxiety situations or stress, such as bad news. Whether you're fired from work, you get a bad report from your doctor, you find that you're having stress in a relationship, whether it's with parents or children or your spouse. You can start dwelling on that, and the anxiety can turn into depression and frustration and anger and lead to a whole series of bad health effects, including lack of sleep, which only aggravates the problem, because when you sleep, that's when your body regenerates your cells and growth occurs and all the good things that you want. And when you don't have that ability, or you lessen that ability, it leads to a cascade of bad results. So let me tell you a few things. First of all, you have to make decisions, and you can't just worry about them all the time. One of the things you need to do before bedtime is definitely do something that gets your mind in a different direction, whether it's reading or watching a TV that's lighthearted or whatever you need to do. Take a walk, breathe deeply, relax, drink some dairy products like milk and give you a little tryptophan, cause you to get sleepy, have a nice, comfortable, cool environment where you have a comfortable pillow in bed, and try to sleep. You can't turn off things a lot of times. You can only turn the channel, as my psychologist daughter says. You can't turn it off, so turn the channel. Think of something pleasant. Always force yourself, and you can get into that habit. And you will receive bad news. No one likes to be laid off, especially unexpectedly. No one likes financial pressures and that, but you have to make some decisions so that it doesn't become a real issue. Life is short. Life's way too short to have stress, anxiety, and worry. In the medical profession, one of the things you deal with is bad medical news. I've had several of my really good friends that have received less than pleasant news, early diagnosis of some cancers. Again, you have to talk to your healthcare provider, number one. Get the real facts. If you have questions or you have fears or you have anxieties, don't lock up. Think and ask and talk to them. If you don't ask the question and you feel unsettled when you're starting to leave, stop. Go back, talk to the person at the desk, ask them to let you talk to a nurse or whoever's available, or your doctor if he's not already in another appointment, or your PA or your nurse practitioner, and get those questions answered. You need to get all the facts. And some people say, well, I don't want to know. If I don't know, it won't hurt me. No, early detection is the key for everything. Most things we find in modern medicine now, if you detect them early, are really curable or really manageable. And so you need to look at that. And don't panic just because there's bad news. The word cancer or cardiac issues or stroke or heart attack are not a death sentence anymore in many cases. So you need to relax, take a deep breath, get the facts, go on the internet to dependable sites like WebMD or Harvard Medicine or some of the great clinics, Mayo Clinic, have some great websites. Carefully look at the information, make informed decisions, and then live the best quality life you can. And if you reduce your stress, your body will heal much better. If you have super high anxiety, the healing process will become really tough because your immune system becomes compromised. You don't want that. You really don't want that. So don't worry, be happy. And you say that's easier said than done. Yes, that is. It takes work to not worry and be happy, but you've only got one life. So make every minute of it count. Life, regardless of whether you live to be 100 or you pass away in your 50s or 40s, that is still, it's the quality of life that matters, not the quantity. So make sure every minute counts. Live in the present. Don't constantly be looking at what the future holds or dwell on bad things in the past. Dwell on the good things in the past. Look forward to future events, but live in the present. When you sit down to eat lunch, enjoy that lunch. Think of it as health and nutrition that's going into your body and something that you like to eat. Go to work. Enjoy that work. If you don't enjoy that work, find a different job. You're not a slave. Go to wherever you want. If you don't like your career, change careers. You say that's easier said than done. I have to eat. Yes, you do. And you may have to plan in that, but you've got to change things that chronically cause you an issue. A lot of people in jobs, the biggest problem we have in jobs a lot of times is not the work we're doing, but our supervisor or our coworker that we really have issues with. And you have to ask yourself, am I the problem, or is the problem surrounding me? And if it's surrounding you, if it's you, you have to change your behavior. If it's someone else, then you need to change their behavior, which is not possible. So you have to change your circumstance. You may have to make a move. If you're unhappy with the major you're taking in school, then change majors. Yeah, it may be some time and money that wasn't well spent, you think, but all education's a wonderful trip and enriching in your life. And go ahead and change directions. Nothing wrong with that. Who knows what they want to be when they grow up? At my age, I'm not sure what I want to be when I grow up. The thing I do know is I found my passion early that I want to help people have a better, healthier life. So this is Dr. Frank with My Doctor Said What? And I ask you to look up me on all major platforms. So happy you joined me today, and hit that subscribe button on YouTube, and let's see if we can get some subscribers, and I'll continue to be here to help you. Have a great day. Remember, send your comments and questions to Dr. Frank at mdswpod@gmail.com.